Hi, hi everyone. Can you hear me? Okay. Okay, so if Faber agrees, I can start.
Yes, absolutely. We can go ahead and start.
Okay, thank you. I'm gonna share screen. Okay. Okay. Can you see it? I think yes. Okay. Off I go. Okay. So I have a problem with this one. Okay. So hi everyone, and I'm Rosario De Feo. I'm a medical student from University of Salerno, so I'm in Italy. And today I will be presenting on public health and prevention, this sixth session of SEMQuest 2.0. And so let's go ahead. Okay. As a starting point, I would be really happy if you could, you know, take this code or use the number that is above and enter this word cloud because I think that health starts with a word, and let's pop up the bubble and speak together. I think just let me know if it's working. I will share. So thanks to this code, you should be able to write some words that recommend you the prevention. And please let me know if it's working. I will share my screen in order to see your word cloud. Yes. Okay. I will give you like 1 minute to write other words if you want. I see that some people are joining now, and this is the code that you can scan in order to participate to this word cloud. So everyone can just type 1, 2, or 3 words that pop up in the your head when you hear the words prevention and public health and this. Okay, one say hola, and okay, they're arriving. Okay, so people, health, prevention, epidemic, coronavirus, well-being, prevention, people. Rebellion. Okay, yes, if you have issues, you can also write them in the chat. This is the code, I'm sorry, just to show you. Okay, I will check also the chat. Okay, so rebellion. Okay. And TVEX, okay. Then care, protection, people, awareness, epidemic. Yes, Facila. Okay, no. Awareness, okay, epidemic. Okay. gloves, okay, face masks, and doctors. Okay. Um, I think we can go ahead. It was just like an icebreaker to begin and a little brainstorming in order to see what you're thinking of when we are just talking about public health and prevention. And I think that we can go ahead. I don't know if you know how it works. This kind of word clouds. So the words that are most of you have written are hospitals and doctors, basically, because they are a little bit bigger than the others. So I think we can go on. Okay. So as I said, we're gonna talk about public health, but in order to start this in a good way, we should define what is a public health for the WHO, that is the World Organization, Health Organization. And public health is the science of and art of preventing disease, prolonging life, and promoting health through the organized effort of society. So, as you can see, as you can see, it is not only related to health like diseases, but it's more than hospitals because the public health is related to we are going to what is defined as one health. So it's the capability of having together not only the diseases, so the man, but also the environment, and also all is related to the environment. So we can see that it's like a puzzle that is building up. So like we have preventing problems and healthy lifestyle that are related to diseases and how men are, but also we should create healthy places, but also triggering the risks, like some of you have just written, you show the words of coronavirus, so also the risks, but the risks are not only because of infectious diseases, but also like the environment we are in, and also the animals that are together with us. And the other part, very important, is the teaching and empowering. That's and why we can see. So as we said, health um, is not, as the World Health Organization stated in 1948, health is not related only to disease, but it's defined as a state of complete physical, mental, and social well-being, and not merely the absence of disease and pain or infirmity. And that's why we should define what is and what are the prevention levels. There are 3 levels of prevention that are really, really important, and I want you to keep in mind during all this presentation. Because we have a first, so the primary prevention is related to prevent illness in the more general way. So when you heard about no smoking, having a good diet, or vaccines are part of primary prevention. Then you have the secondary prevention that is related to detect early the disease that can occur in men. So all the cancer screening are part of secondary prevention, like pap test, or when you go to the dermatologist, it's all related to, for melanoma, it's all related to secondary prevention. And then we have the tertiary prevention, that is the prevention that occurs in patients that have already illness, so they are already having going through some problems with their health, and we have to limit the complication. So for diabetes, for example, we have to all the management of the insulin, and also for example, after cancer, we have the rehabilitation. So which we are moving, and what the World Health Organization is trying to say to tell us is that you should not only prevent your health but also promote. So the health promotion is making healthy choice the easy choice, And but I want you to think about this part, because we have this in this way. I think you can see my arrow on my house, and in this way you can understand that people in this state, they are basically good. So they have no illness, no diseases at that moment, and then they go through a problem. So that's why we should go on primary prevention. That is the most important one to highlight and to communicate to people, because the more you go to tertiary, the more the costs and suffering are are growing. So it will be more costly, not only for people, but also for the health system they are in, and the same for suffering. So I was trying to introduce yourself in the definition of non-communicable diseases that is nowadays called also the silent epidemic. And that's it's why, um, as you can see in this circle, that is also from World Health Organization, we should look at the big picture that we have here reported, because according to the last report, in 2021, we had 43 millions of deaths, and 75% of them were from non-pandemic deaths. So it's meant that all these deaths could have been prevented. Like, in which way? In this way, the ways that are shown here. But as I told you now, we should also think why all should care, because they are not happening not only in the elders one, like we when we think about diseases in common thoughts, they are more related to people that are older and like these. But it's important to understand that the prevention and the highlight of the public health starts when we are young. So until now, we should have a look to these 9 advices that are coming from World Health Organization, and we are going through them in this presentation. And as a matter of fact, I want you to show that, as I have said here, so the 75% of these deaths were from non-communicable diseases. That, to be more clear, that are all the diseases that are not infectious. So they are not transmissible like through the air or like that, but they are, chronic in this way. And we can see here, like we had in 2021, 19 millions, 10 millions, 4 millions, and 2 millions of deaths because of these diseases that, through prevention, could have been they could not been occurred. And what are the risk habits that we should look at and be aware of? The tobacco, so the smoke, the alcohol, that World Health Organization has stated that there is no limit for alcohol. Also, 1 glass of alcohol can be harmful, and unhealthy diet, physical inactivity, and air pollution. But we know that these are things that all of us know, so it's kind of an invitation to be aware of them and also to tell everybody about it. So we can say that non-communicable disease don't spread like viruses, as I said, but they're the biggest, most preventable threat to our generation. But this part of prevention is basically related and promoted from the state, from the countries we are in, and so we should also think about what shapes a healthy system. So I have written down these 3 topics that are financing. So who pays? Are the campaigns and all the based on tax, insurance, or out of pocket? There is the service, the delivery. So who provides? Are they public, private, or NGO? And what about governance? Who decides? Is there a central decision, or community, or little state? So here I try to, with a little bit difficulties, put in this table all the mm, basically the differences that are in these states, in this country. For example, we have in Italy, like here, I'm in Italy, and in Italy we have the essential level of assistance that are all these campaigns that are made up of the state in order to prevent the diseases that are more common. So, you know, for colorectal cancer or for breast cancer, and it's in Italy it's all based on public money. But as you can see here, we have like north-south division and differences because of the coverage of the hospitals. And maybe we can go to another state, maybe, I don't know, US, as we can see, and as we know, we have a mixed market. So it's a private insurance and Medicare, Medicaid, and so we have zero cost preventive benefits for the insured, booming telehealth, and but it is like intent that fragmented coverage and rising preventable mortality is the main gap in the US. And then I don't know, we can go to South Africa, for example, and we have these two-tier tax-funded public and private insurance. And the main gap is about large public-private equity gap and understaffed clinics. So that's the main problems. But when I was preparing this presentation, I was also thinking about AI. So what can AI do to boost public health globally? Because it is clear to everybody that AI surely will do bad things, but also good things. Because I think that, and you can see from all the congresses that are going on in the world, AI is coming in more and more in the world of medicine. And thanks to AI, we can, of course, spot early the diseases, or we can provide a fast triage in the maybe in the places of the world where there is no triage. For example, we had in South Africa the problem of ER, so emergency department, and a fast triage with AI could basically fast and make less deaths, and but also thanks to the data we can give to AI, should have smart reminders or drone delivery. For example, we have talked about vaccines, and vaccines maybe in some areas of the world there are no vaccines, and the drones could deliver those medicines or any other kind of medicines, or food and like that. And another part, very important part of the AI, would be the predictive disease models. So these models that are trained on our data will be able to have the prediction in the people who are developing a disease. But as you have heard, may heard in these days, AI is of course a powerful tool, but it's not perfect. That's why we should have it also in the everyday life, but also and mostly in the hospital, as a tool that can help us, because the humans must be in the loop, as you can see here. So given this problem stated, so we have, as I said, the guidelines from WHO and all the societies that are related to health, because there is not only the WHO, but there is other society like ESMO, that is the European Association of Medical Oncology, and also all the public health institutions of each state that have these guidelines. So they provide to people, but the problem is that people are not strict, they are not following those guidelines, and that's why we have these high rates of non-communicable diseases. So for the people who are interested in, like yourself, that you're following this webinar, I think that you can be interested. And so this slide is like, what can we do to share and to make these all these advices and all these you know, uh, things to do more wider and common. I have divided in two parts, so the micro and the macro. The micro is what you can do on yourself, on your own, from now on, so from tomorrow. Okay, like you can track 10,000 steps every day in order to stay healthy, because the WHO says that you should have 150 minutes of physical activity at a week. And or you can set phone reminders for your the meds of your and visits for you and your relatives, or maybe you can share WHO reels, or maybe on once a week on your social media. But it is clear that it's the solution of non-communicable diseases is not up to us, but is up to the states and this international government. So what is the macro? What we as a society, as voting people, we should do. So maybe we should enforce more than 30% excise taxes on tobacco and sugary drinks, but also alcohol. As I said, there is no limit for the alcohol to be damage for our organism. And maybe launch a global NCD solidarity fund to help low-income countries to scale prevention. And in the middle, you can see one thing that I think is in the middle from between micro and macro, because it's a congress that we organized at Mayo University with my friends of an Italian association I'm part of. That was it was organized from us and our professors in order to underline the importance of prevention. In Italy, missione prevenzione means mission prevention. So we organized this one-day congress. During the morning, we had our professor. We had like 20 professors speaking about all the rules and all the rules that people should follow in order to stay healthy. And during the instead in the afternoon, we had, as you can see here, the possibility to donate the blood, and also to have the typization for the bone marrow donation. And also all the association of my part of Italy were invited to underline the importance of the primary and secondary prevention, as I said at the beginning. So I decided to put it here in order to tell to you that it's important, it's an important topic, and I think that all of us can do something in our little space. So, and that's why small daily choices scale to big global changes. And then here I have a topic for you, so, and a task for you. So if Abir can divide I don't know, the people, is it possible? Otherwise, we can go and have it together.
Right. So I think that feature is not available regionally for me, so I don't think that would be possible.
Okay, so I will go through, and here I decided to put small tasks in order to have your creativity going on. And so that's when the going gets tough, the tough gets going, and so it's the moment to get our hands dirty. And so I will share the I'm sorry. Okay. The study cases. I had thought that maybe we could divide them for each 5 people, but we can do it together, basically. So I have prepared these five case studies, and because I thought that after the words that I just told you, it was important to be in a particular situation in which you can see how the prevention and public health is not very present and is not represented. So you could maybe organize and try solutions to them. So I don't know. Given that we cannot divide into rooms the participants, maybe I can read the case study and we can work on it. So the first case study is in Italy. So you are a public health officer in a rural town in southern Italy with a population of 3,000 people. Many elderly residents rarely attend medical checkups, and nearly a third may have undiagnosed hypertension. The only clinic operates 3 days a week and has limited staff. There is no structured screening program, and patients typically seek help only when symptoms become serious, leading to preventable strokes and heart failure. So the aim is, what should you do? What will you do if you are in this situation? I don't know if someone wants to speak or also write in the chat. Okay. Okay, so Lily says, raise awareness with free short sessions in the hospital waiting area. Drop your, okay, disappear. Okay, so Arita saying, provide incentives to doctors and medical professionals working in rural areas. Okay. I will wait like 1 minute. And okay, so say screening and early detection. So I think say you should you'd like to say that maybe you can have their pressure. You can measure their pressure in order to have a screening about that. I think you were meaning about this. Okay. So Meridini says, we would definitely have to change the working times to all days of the weeks and encourage people, elderly to younger people, to visit doctors before symptoms get bad. So invest in sending students to med school, okay, organizing activities for elder people, and when they get together, having them understand the importance of health checkups, and also having like so where they can get their checkups in those programs. Okay, wonderful. And I would design a program having free of local blood pressure checks at the local community spots, also using trained volunteers to help. Wonderful. Use mobile health vans or local events to offer blood checks. So wonderful. So every one of you has underlined the problem that was the blood pressure. It was not the problem, and then we have Zainab that's detecting health issues early and educating the community to help them control their health issues and live better. So And now I can see Jennifer that is implemented a school-based health education program focusing on nutrition and exercise, partner with NGOs to provide pre-diabetes screening during school hours, train teachers as health ambassador. So great. I think Jennifer was answering to the case study number 2 that I will read it and then we can discuss. Basically, public school in Nairobi, Kenya, enrolls over 2,000 students. Many come from families with high prevalence and of overweight, poor diets, and sedentary lifestyles. But there are no preventive services or health education programs. The local clinics are overcrowded, and most families have never been screened for diabetes. Awareness of risk factors is extremely low, and complications often go untreated until late stages. So I think we can have just the last one, and then we can speak about that. I don't know, maybe this one, case study number 4. In large Syrian refugee camp in Jordan, housing over 40,000 people. There is a critical gap in preventive health care for women. Women over 40 rarely receive breast or cervical cancer screening, and many are unaware of symptoms or risk factors. Due to cultural stigma and fear of bad news, very few attend the few mobile screening clinics that visit occasionally. The camp has extremely limited access to doctors, and language or digital barriers make outreach difficult. So, what would you do in this situation? I will wait like a minute. Is there anyone that is thinking about that? Okay. I want to just to say that I chose these 4 case studies in order to talk ourselves about them because it's I'm from Italy and there are also people from major states but are also from low middle income countries, income countries. So it's sometimes it's very difficult to understand the situation that we are in. That's why I chose this one, for example. And let's read about Lily. And she says, see if some of the refugees themselves were once doctors or get more stuff from the refugees themselves, also raising awareness that would prevent harm, not cause. Wonderful. Spread awareness in their language. So like translate, we should maybe find someone that is able to speak English, that we, okay, and train female health workers, private and self-education session, sensibilization of general population, informing doctors on how telling bad news, wonderful, Pierjo. And then Jennifer says, train female health workers from within InChamp to lead awareness session, build trust, and encourage them at screening clinics. That's a good point because as you just telling, as you're saying, sometimes the problem is about the conception they have about these medical issues. Then I would work with trusted female communities health volunteers from within the refugee community. Also, I would use visual flip charts, Arabic, to build trust and educate people. Wonderful. So some of you are also talking about the translation and community groups where health care workers raise awareness among the locals and train people how to self-checks for early detection of breast cancer. So wonderful. And then this is an important one, improve access to vaccine like the HPV vaccine, which I suppose can prevent cervical cancer. Yes, of course. So wonderful. Thank you. Thank you so much for sharing. I'm sorry I could not have divided you in rooms. So I'll go back to the presentation. And so you have had an amazing job, and you were able to see all the problems and the problems that are different in different countries. So, for example, in Italy, you have a basic the health is basically more high than other countries, and that's why the problems are different, and that's also why the guidelines are and must be very different from country to country. So I'm gonna go back, and I'm here. So in order to go through the conclusion, like to have a little bit a recap of this presentation. So we have just said that public health uh, basically means prevention first, because as some guidelines and says, prevention is related to make the health better, and in order to not make ambulance come, so keep world population healthy, not just treat illness. So all that is related to mental health, but also the environment you are in, all the pollution and the animals. So in the optic of the One Health, non-communicable diseases are the silent pandemic that is going on in our days. So the 75% of global health yet largely preventable, because these diseases, because they are called non-communicable diseases, for their nature, they are preventable. So a lot of work must be done in this. Then we have seen all the health system differences and design. So we have seen like the difference in Italy, US, India, and this is not a thing we should be aware of. And then maybe for the future, and we hope that artificial intelligence is now a new ally, and it will be in the future, from early risk alert and detection, maybe for melanoma, so skin cancer, but also for all the other stuff we have just spoken about, to maybe supply chains for the drugs and vaccine, as for the HPV, for example, as somewhere you have just said. So to conclude, I've written down this statement that is prevention is the world's most inclusive team sport. Everyone can play and must play. And I go through the so this is me. I'm Rosario, as I said at the beginning. Thank you for your attention, and I hope no one of you get asleep. And so just to say, here are my contacts. So I'm available if you want to reach me out. Don't worry, it's my email and or LinkedIn. And so I'm a medical student and the Department of Medicine, Surgery and Dentistry of University of Salerno. And my interests are in translational cancer research, public health, and nutrition. And also I love playing sport, music, and meeting new people. And these are all the references I've used for the presentation, and I will send you back when in the group chat. So thank you so much for your attention.